Hello, my name is Tanner Gordon and I'm a recent graduate from Valdosta State. I graduated in May with my BBA in Healthcare Administration, and now I work at South Georgia Medical Center in the Medical Staff Services Office, and we are in charge of credentialing and privileging all healthcare physicians and mid-levels that come to work in our hospital. So I deal with lots of other healthcare professionals. I am in charge of shadowing students and medical students. They go through a process in our hospital to get credentialed and verified to make sure they are ready to go. And then I also am in charge of hospital affiliations. So I'm doing my project on the opioid epidemic. So every day in America, there are 115 overdoses from opioid misuse. That's a lot. It's a very serious problem that is taking place. Opioids are a type of drug that are used to treat pain, and they come from a plant called opium, which has poppies. People are overdosing on prescription drugs, heroin, and synthetic drugs such as fentanyl. The number one cause of death in people under the age of 50 is drug overdoses. So throughout my project, I'll talk about causes, effects, children, and ways to help and prevent further destruction. Hope you enjoy. President Trump declared the opioid problem a national crisis in October of 2017, but with this, there was not any financial relief for the individuals or communities. This crisis is extremely severe and is causing harm to social and economic welfare along with public health. The Centers for Disease Control and Prevention have projected that the total economic burden for opioid misuse a year totals to about $78.5 billion. That number includes cost of healthcare itself, productivity loss, rehabilitation treatments, and law enforcement involvement. The opioid epidemic has many causes and effects that hurt not just the users, but also society as a whole. For decades in the 1900s, doctors were said to be conservative on narcotic dispensing during end-of-life care. Pain management advocates started pushing for greater use in drugs to relieve pain. Since then, pain management has been a huge advancement in the medical world and has been top priority for decades. Roughly 100 million people in the United States have issues with chronic pain. In America, there is approximately $550 to $640 billion spent on chronic pain a year. It was found that in countries with the lowest social capital, which is economic resources gained by relations with individuals and businesses, that there were the greatest number of overdose rates. Back in the later 1990s, drug sales representative companies promised providers that patients would not become addicted to prescription painkillers. Because of this, providers trusted the companies and began to prescribe more. This is where the opioid problem first began. The pharmaceutical companies were extremely wrong and people began these medications. It was not caught at first that it would become a major problem, but once it became a national problem, it was too late. This drug abuse has become a countrywide crisis. About 21 to 29% of people that are prescribed these drugs are abusing them. From 1999 to 2016, data shows that over 630,000 American citizens have died from a type of drug overdose. The opioid overdose death count in 2016 was 5 times higher than in 1999. Physicians were taught to treat pain forcefully, and they did just what they were taught. There are also connections to poor health from poverty, bad working conditions, and when individuals lack opportunities in their lives. The abuse is continuing to advance. In addition to the growing abuse, the medical field has also seen an increase in neonatal abstinence syndrome. Neonatal abstinence syndrome occurs when the mother of the child was misusing opioids during her pregnancy. The newborns are born with a drug withdrawal syndrome known as neonatal abstinence syndrome. Every 25 minutes in America, a baby is born with this condition. According to the March of Dimes, most symptoms and signs are identified within 72 hours of birth. Of course, there are always exceptions. Some can take up to 6 months to appear or can occur directly after the birth. Symptoms and signs can include things such as tremors, seizures, low birth weight, respiratory issues, trouble sleeping, and diarrhea. The symptoms can vary and depend on the type of drug that was taken during pregnancy and the amount of the substance. Babies might appear to be jaundiced if they are victims of neonatal abstinence syndrome. Newborns that were born with NAS in 2012 stayed an average of 16.9 days in the hospital after birth. The average stay of newborns born without this syndrome is 2.1 days. These lengthy stays cost the hospital approximately $1.5 million, in which 81% of these costs were paid for by Medicaid programs in the birth. This supports the claims that most mothers who misuse opioids during pregnancy come from lower income areas. Mothers that are using opioids during pregnancy and want to quit must first seek help from their doctor and partake in treatment. Quitting suddenly could result in complications and even death for the unborn child. Babies that are diagnosed with neonatal abstinence syndrome can be treated a few different ways. The doctor might order for the baby to take medication to combat the withdrawal or give fluids through an IV to prevent dehydration. He might also put the baby on higher calorie formula to help the baby gain weight. Babies and children are the silent victims of opioid abuse. Many children of parents that are addicted to opioids are being put into state-funded child protection systems and foster care. Children are victims of this horrible disease and often watch their parents face addiction. They are neglected. The Public Children's Services Association of Ohio has conducted research and found that in 2015, 1/3 of children in custody were there because of the opioid epidemic. Ohio is ranked second in the greatest number of heroin overdoses. The state is estimated to spend on average $45 million a year on placing children in state custody programs because of parents with opioid heroin addictions. These children are innocent and have done absolutely nothing wrong, but yet are still facing horrible consequences from this awful addiction. Some have parents that are more worried about finding money to buy the drugs than putting food on the table for the children. The biggest concern is the child's safety when living with a parent whose main focus is getting their hands on drugs. Foster care programs are being flooded with the amount of children in need of a home, and it is only going to get worse. More foster families are needed to combat this growing epidemic. There is a new federal act, the Family First Prevention Services Act, that is set to take effect in 2019 that will help with additional funding for foster families. The law will take funding from shelters and disperse it into foster programs. The goal is to provide a loving, stable, and nurturing environment through the foster homes. But with funding being taken away from shelters, more kids will be put into foster families, so the need for additional families is crucial. Also, the act will help fund mental health treatment, substance disorder treatment, and parenting skill programs for parents so their children can remain in their home and not have to be put into the system. Some doctors continue to write prescriptions to patients even when they know they are addicts. There are a number of reasons for this behavior. Patients are sometimes required to fill out surveys based on the quality of care received by their physician and how they treated their pain. If the physician does not refill their pain medication, they might be more likely to give them a less than perfect rating. Sometimes these scores are posted online, which can hurt the doctor's business. Low ratings can even affect a doctor's reimbursements. I read a study conducted by Ann Lemke, who asked other physicians how they handled these situations. One of her colleagues stated that sometimes he just has to do the right, ethical thing, even if that turns into a patient writing a bad review on him. Many people in the United States believe that all types of pain can be treated in some way. They believe that the pain is suggestive of pathology. Some also believe that if the pain is left untreated, that it can lead to psychopathology, such as post-traumatic stress. Because of this, some doctors that refuse to prescribe opioids for treatment can be seen as suppressing relief because it may lead to further problems such as psychological harm. Addicts use this to their advantage to get the prescriptions they are so desperate to get. Currently, the pay is better for doctors to prescribe opioids to patients they know have addictions than to educate them on the addiction they have and treat. As of July 1st, 2018, new regulations were put into place that make prescribing a lot more difficult. The goal is to make it harder to obtain these drugs. Just recently, the largest fraud scheme was taken down on June 29, 2018. The mastermind scheme involved over 601 people for their part in this dreadful scheme. The losses from this fraud scheme totaled to over $2 billion. The individuals included people such as doctors, nurses, and other licensed professional medical people. These individuals would bill government-funded programs such as Medicare, Medicaid, and TRICARE for prescription pain medications that sometimes were not even picked up by the patients. The Attorney General of the United States spoke out on his thoughts of this situation. He said that he believed the providers were taking advantage of these addicts and using their addiction to fuel their pockets. Physicians will write prescriptions to patients with known addictions to continue to increase profit for their practice. It is reasons like this that have fueled the fire of this epidemic. Without a united front on stopping this epidemic, it will continue to spread. Medical professionals with the wrong intentions and do not have patients' best interests at heart have a part in this. To be able to combat this horrible epidemic, it is vital for resources to be made available to users. Things such as counseling and treatment options are imperative for their success in fighting addiction. With recent Medicaid funding, it has been made possible to treat more abusers and give them assistance. Medicaid has also helped ease the strain on hospitals for uncompensated care. But with talk of altering or repealing the Affordable Care Act, things could really change for substance abusers. If the act were 2.8 million Americans with substance abuse disorders will lose all or some of the health care insurance. Of those 2.8 million Americans, 220,000 have an opioid addiction. These individuals will be less likely to seek help if the cost is driven up. With financial straits, it could also cause them to relapse or further their addiction more. Stress is a major trigger for addiction. So, just to do a little recap, this epidemic is not just hurting the individuals that are misusing the drugs, it's hurting the country as a whole. Babies and children have suffered, as well as family members, community members, and other individuals from secondhand exposure. With continuous efforts to stop this epidemic, hopefully there will be change, but everyone has to help out. With stricter regulations that were put in place on July 1st, 2018, there is also hope for change. It is time to take a stand and do what is right. My mother is a pharmacist, and I've heard her talk about this for multiple years, and it's always been interesting to me just to hear all the causes and effects that go into this epidemic. Hopefully with stopping prescriptions from being written so loosely that it will stop the problem from the beginning, that will also eliminate a main source of the problem. If nothing is done, the numbers will continue to grow like the trends from the past. More people will suffer, more people will die, more individuals will be affected. So the sooner everyone gets on board with what's happening, the faster we can control this issue. Hopefully with the new efforts in place, progress will be made and peace will be restored. Addiction is a powerful disease, and it takes efforts from all to fight the war. Thank you for watching.